Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Right. Retrosternal goiter. Retrosternal goiter is also called as substernal goiter. Retrosternal goiter is also called as substernal goiter or mediastinal goiter. A goiter is said to be retrosternal or substernal if more than 50% of thyroid tissue is located inside the thorax or below the behind the thorax, behind the sternum. In such cases, inside the thorax, that too behind the sternum, it is called as retrosternal goiter, substernal goiter, or mediastinal goiter. Usually, this retrosternal goiter it arises from the lower pole of the nodular goiter. Origin is from the lower pole of the nodular goiter. This retrosternal goiter will develop. Most of the times it is asymptomatic. Most commonly it is asymptomatic, and it is in most of the cases it is asymptomatic, and it is incidentally discovered on an x-ray, on a routine x-ray examination. On routine x-ray, this mediastinal goiter is detected. Right. Now, the main important thing in the mediastinal goiter is these mediastinal goiter can cause clinical features, especially in the clinical features, they cause severe symptoms. Why? Because of the pressure effect. So, these retrosternal goiter will have a severe symptoms due to mass effect or pressure effect on the trachea, esophagus, and also great vessels, and also on the nerves. Right. Now, if there is pressure effect or mass effect, if it is present on the trachea, then if it is present on the trachea, obviously it can cause dyspnea, and this dyspnea is most common symptom. So among all these, dyspnea is most common symptom, and this dyspnea is most commonly seen at night. It is most commonly seen at night. And because of the compression of the trachea, the patient can also present with cough, and the patient can also present with stridor. Then, if the retrosternal goiter compresses the esophagus, in such cases the patient can develop dysphagia. Then, if the if the retrosternal goiter compresses the nerves, especially recurrent laryngeal nerve, it can cause recurrent laryngeal nerve palsy or any recurrent nerve palsy. Then, if it compresses the great vessels, especially the veins, so whenever it compresses the veins, then it can cause enlargement of the neck veins, and superficial veins can also be enlarged. Here, in the retrosternal goiter, there is a sign called as Pemberton sign. Okay, this Pemberton sign is very important. In a patient with Pemberton sign, here you will have to ask the person to raise the arms above the head. Ask the person to raise the arms above the head. When the arms of the person are raised above the head, then this will compress the this when the arms are compressed above the head, then the retrosternal goiter will compress the great vessels in the neck, and thus you will see that the patient will experience faintness. He feels as though he is going to be to faint. And also the patient will also have facial congestion, and external jugular venous obstruction is also seen. So because of the external jugular venous obstruction, the patient will have facial congestion. This will help us to recognize the retrosternal goiter, or also called as mediastinal goiter.
Thank you and thank you for watching.